Okay, so before entering the patient's room, I would check the electronic health record to see or to look at her lab values and to check for any new or needed orders. And once that's all clear, I will get to the patient's room and check the door to see if there are any flags or markers indicating any special needs for the patient, which there aren't. So I'm going to knock and enter. Wash my hands. Hello.
Hi,
Can I get your name and date of birth?
Abigail Service 7/6/2000.
Okay, I'm Grace and I'm going to be your nurse today.
Hi, Grace.
So what brings you in today?
I fell rollerblading and I hurt my wrist.
Okay. When did this happen?
About 2 days ago now.
Okay. And you said the pain is in your wrist. Is it radiating anywhere?
No, it's just pretty much staying in my wrist.
Okay. And can you describe the pain for me?
It throbs a little bit and it's a deeper pain.
Okay. Can I have you rate the pain on a scale of 0 to 10, 0 being the best, and 10 being the worst?
0 being the
0 being the best, 10 being the worst.
0 is the best.
Yes.
Okay.
Like no pain.
Okay. So like a 6.
Okay. And can I forgetting what I was gonna say. Oh yeah. Do you do anything that makes the pain better or worse?
I've been putting ice on it and occasionally taking like a ibuprofen, Advil.
Okay. So now I'm gonna check your vital signs if that's all right with you.
Mm-hmm.
Okay. Can I have you sit up on the edge of your bed here? Okay. So I'm going to check your pulse oximetry here. 99% looks good. Next, I'm going to check your apical pulse. In a real scenario, the patient would not have a shirt on or I'd be under the shirt, but because this is a demonstration, I'm just going to go outside of her shirt. Okay, so she has an apical pulse of 72 and respirations of 14. Next, I'm going to check the patient's temperature. .6 looks good. And now I'm going to check for her blood pressure. Do you know what your blood pressure is normally?
Usually about 120/60.
Okay.
In that range.
So first I'm going to use her brachial pulse to estimate her blood pressure. rest a little before I take it again.
What do you like to do in your free time?
I like to go running, and I like to be outdoors. How about you?
I'm a swimmer, so I usually swim.
Okay, that's good to hear.
Yeah.
Sounds good. And it was 120/58.
I say.
Mm-hmm. Okay, so next I would take note of the patient's appearance, noting that she is alert and responsive, her eyes move spontaneously, she has pink undertones to her skin, she looks like she has good hygiene, what else? She has good body alignment. She looks like she's sitting comfortably. Doesn't look like she's in too much pain. She has good speech. She responds appropriately, so it sounds like she hears well. Yes, she talks very clearly, so it doesn't look like there's anything wrong with that. And next I would move to her neurological system, which is where I would note that her eyes are open, they respond spontaneously, blinking. She has purposeful motor movements. She doesn't look like she's struggling in any way. She has good verbal responses to me, no facial droop. I will check her pupils. Okay, which it looks like they are both equal bilaterally, about 5 millimeters in diameter. And now I'll check for their response. They respond briskly and appropriately. So next I would assess the patient's muscles. Can I have you squeeze my hands for me? Okay, perfect. And now can I have you hold your arms up like this? Can you pull towards you? Okay. And now can I have you push away? Okay. So now I'm going to check your legs here. Can I have you push away? Okay. And now pull towards. Okay. And have you been experiencing any numbness or tingling in your fingers? Or anything like that?
No.
Okay. Okay. So that looks good. And next I will move on to her respiratory system. She looks like she's breathing unlabored. Have you been having any troubles breathing lately?
No.
Okay.
Not at all.
Now I'm going to auscultate your breath sounds. I'll do 6 on the front, 8 on the back. And each time I move to a new location, I'm going to have you take a deep breath in and out, okay?
Sounds good. side here.
I'm going to move to your back here. Okay, so her breath sounds clear. There aren't any crackling. There isn't any crackling or anything like that. Next, I would ask the patient, have you had a cough or any mucus buildup lately?
No.
Okay. And if she had, I would educate her on using a incentive spirometer and deep breathing and turning regularly. So next, I will move on to her cardiovascular system. So I'm just going to listen to your heart sounds.
Sounds good.
So that sounds regular. She has a strong heart, strong pulse. No murmurs or anything like that. Next, I will change it to the bell to listen for any bruits or anything like that. And that sounds good as well. She has a regular heartbeat. Yeah. So next I would check for capillary refill in her fingers and toes. That looks good. She regains color in her fingers in under 3 seconds. And that looks good as well. How is it moving your fingers and toes? Is everything okay with that?
Yep, I can move all 20.
Okay. And then I check for peripheral edema in her legs. Okay, and there isn't any there. So next I will check her radial pulse here. Strong, +2 to her tibialis or tibial pulse, I mean. And dorsalis, pedis. Which is +2, equal bilaterally. And lastly for this, I would check her IV to see if everything is working properly, if she has the right amount of fluid, and things like that. So next I would check her skin and her skin integrity, which looks good. There aren't any openings or any lesions or moles or anything like that. I'd check her temperature, which is warm and equal bilaterally. And I would check for skin tuger. and her skin goes down right away, so she must be well hydrated. And next, if she did have any integrity issues, I would use the Braden scale to rate any skin integrity issues. And also, if she had an airbed, I would adjust it or something like that to make sure that everything is working well in that area. And next, I'll ask the patient about her voiding and urinary system. So, are you voiding regularly with urine? Are you
Yes.
going to the bathroom regularly?
Mhm.
How many times would you say you go in a day?
Like 4 or 5.
Okay. And can you explain the color?
It depends on the day. Some days it's pretty yellow. Some days, if I drink a lot of water, it's clear.
Okay. Do you have any pain when urinating?
Nope.
Okay. And if there were any issues that I noticed, I would do a bladder scan on her. And so, yes. So next I'm going to check her abdomen. And can I have you lay down back on the bed?
My 6-pack.
Okay. So I would note that her abdomen is flat. It's not round or anything like that. And I am going to listen to the sounds. Okay, so sounds are present in all 4 quadrants, which is good. And next I'll palpate her abdomen to check for any lesions, pain, or tenderness. And also I'm noting that her abdomen isn't distended or rigid or anything like that. So I start with light palpations first for comfort. And then go deeper. Okay, and everything feels good there, so there's nothing concerning or anything like that. So, have you been feeling nauseous or sick or anything like that, vomiting?
Nope.
Okay, that's good. Do you have regular bowel movements?
Oh yeah.
Regular stool? Okay.
Yes.
Can you describe the appearance to me? Is it
Soft and formed.
okay? That's good. And the color?
Brown.
Okay. Would you say you have regular bowel movements? How many times do you go in a week?
Once a day.
Okay. Good to hear. And so next I would assess her mobility and see how she moves in bed, if she's getting up all right and going to the bathroom okay. Do you have any troubles with that?
Not at all.
I would see if there are any orders for TED hose or STDs, and or assess the ones that she has on, but she doesn't have any need for that or anything. And I would assess the patient for fall risks, and she isn't one, so that's all good there. And I think that is all. Do you have any questions of me?
Not that I can think of.
Okay. So before leaving, I would make sure that the bed is locked and lowered. I would make sure that the patient has her call light, ask her if she needs anything, wash my hands, and leave the room. I would document anything else. And that's all. Thank you.